Good morning, everyone. Today is April 25th, 2025, and Madeline is going to talk about the gallbladder and what it does.
All right, good morning, everyone. My name is Madeline McMillan, and I'm going to be telling you all about the gallbladder. So by the end of this presentation, you should be able to describe the function of the gallbladder, list the common gallbladder disorders, and explain how removing the gallbladder can affect drug and nutrient absorption. So first of all, what is the gallbladder and what does it do? So the gallbladder is just a little sac, basically, that's sort of tucked under your liver. And what it does is it helps to store and release bile. Now, it doesn't make bile, it just holds it until you're ready to eat. And bile is a mixture of cholesterol, bilirubin, and bile salts. It's made by your liver, and it's really important for the digestion of fats. Now, your gallbladder is connected to your whole digestive tract through the biliary system. And that's basically just a system of ducts that connects your gallbladder to your liver and then connects all of that to your small intestine. So again, like I said, the gallbladder stores bile and it releases bile when you start to eat. Bile is very important for the digestion of fats. And so basically you start to eat and your gallbladder will release bile into your small intestine, and bile works to break down large pieces of fat. It sort of emulsifies the fat to make it into small pieces. And then that allows your pancreatic enzymes to further digest fats. So one of the main things that can essentially go wrong with your gallbladder is gallstones. They're very common. Somewhere around 5 to 10% of people have gallstones. And basically how they're formed is when bile hardens into little stones. Now, the medical term for this is cholelithiasis. But that's basically just when little stones form in your gallbladder. Now, gallstones are usually composed of cholesterol, which is a normal component of bile. Also, calcium salts, bilirubinate, and proteins can form those gallstones as well. Like I said, they're very, very common, and a lot of people will actually have gallstones without experiencing any symptoms. A lot of people who have gallstones don't even know that they have gallstones. But once you start experiencing symptoms, you are considered to have gallstone disease. And some of those symptoms might look like having pain in the upper right part of your abdomen, as well as nausea and vomiting. So some common risk factors for developing gallstones. Unfortunately, females are significantly more likely to develop gallstones than men. Age is also a big risk factor. So our older patients, if you get above 50, you are going to be more likely to have gallstones. Family history is another big one. If your parents had gallstones, there's a good chance you will have gallstones as well. Pregnancy, diabetes, high cholesterol, those can also contribute to gallstones. Obesity or losing weight rapidly can put you at increased risk as well. And then certain medications like fenofibrate, which is used for cholesterol, or estrogen therapy can all increase your risk of developing gallstones. Now, there are a few ways that you can prevent gallstones, whether you've never had them or if you've had them in the past and you want to prevent your risk of having more gallstones. And the biggest one is to eat a healthy and well-balanced diet. Fats are a big part of what causes gallstones to form. So limiting your intake of saturated fats like fried foods, things that have a lot of butter or cheese, those can all increase your risk. And then increasing your fiber intake. So eating a lot of things like broccoli and quinoa, whole grains, that can help to decrease your risk of developing gallstones. Also losing weight gradually if you're overweight. We mentioned that obesity is a risk factor for developing gallstones. but also rapid weight loss can increase your risk of developing gallstones. So you want to make sure you lose weight gradually. So that's usually about 2 pounds a week is what is recommended. And then getting regular physical activity. So this doesn't mean that you need to go out and run a marathon or anything crazy like that. Just getting up, walking, maybe doing yoga or Pilates, just low impact physical activity can help prevent the formation of gallstones. Now, there are a few complications that can arise from having gallstones. One is cholecystitis. That's basically just when your gallbladder becomes very inflamed because of the gallstones, and that can lead to infection. There's also cholecystolithiasis, which is when the gallstones move out of your gallbladder and go into the ducts of the biliary system. And then there's also cholangitis, which is basically inflammation that arises from the gallstones going into the biliary ducts. And then there's gallstone pancreatitis. So a couple of those complications can create a lot of inflammation, and your gallstone is right next, or excuse me, your gallbladder is right next to your pancreas. And when that's very inflamed, it can also make your pancreas inflamed. This is a big problem because your pancreas makes insulin, among other things. And if your pancreas is very, very inflamed, or if it's inflamed over a long period of time, that can eventually lead to pancreatic failure, which, among other things, will cause you to have diabetes. And then the last complication of gallstones is gallbladder cancer. I think that's pretty self-explanatory. It's cancer that occurs in your gallbladder, and that is obviously something we want to prevent. So the most common treatment of gallstones is to remove the gallbladder. There is a medication that exists called ursodiol. Sometimes that's used to treat gallstones or prevent gallstones. But unfortunately, not everybody is a candidate for using ursodiol. Usually your gallstones have to be very small, and you can't have any of the inflammation or infection complications that we talked about in order to use ursodiol to treat the gallstones. So most people who have issues with gallstones, especially if it's recurrent gallstones, they will undergo what's called a cholecystectomy, which is just the surgical removal of the gallbladder. Now, people who have their gallbladders removed can live normal and healthy lives. It does have that function of holding bile before you're ready to digest fats, but removing that it doesn't cause a drastic change in your body. So like I said, it's a very common treatment for people who have gallstone disease or complications of gallstones. And usually the cholecystectomy is performed laparoscopically. So laparoscopic surgeries are ones where they just make a few small incisions, and then they're able to go in through those and remove the gallbladder. It's much less invasive than a more open surgery. There's a lower risk of bleeding, and it has a shorter recovery time, so you don't have to stay in the hospital as long. You don't have to wait as long for the incision to heal, and you won't end up with a big scar on your abdomen as well. So there are a few changes that occur after you have this cholecystectomy surgery. So like we talked about before, the purpose of the gallbladder is to act as a reservoir for bile. So without that reservoir, the bile is going to be secreted directly into the small intestine. Now, the bile is still there, is still being made by your liver, but it just goes right into your intestine instead of being held until meal times. So a lot of people experience loose stools, flatulence, and bloating after surgery. But this is something that's usually transient. Within maybe a few months or so, most people do kind of adjust and their body gets used to it, and you don't experience this quite as much. But something you can do to decrease some of the digestive side effects of surgery are going to be limiting your intake of fatty foods and increasing dietary fiber. So kind of the same thing that we talked about with preventing gallstones. You want to reduce things like fried foods, butter, lots of cheese, things like that are going to have a lot of fat, and then increasing your fiber intake, like, again, broccoli, whole grains, lots of vegetables. Now, one thing that I want to note about this is that immediately after surgery, your doctor might want you to do like a clear liquid diet for a little while and then gradually add back different food groups. So having tons of fiber right away might not be ideal, but eventually that's kind of the diet that you want to adopt after you've had your gallbladder removed. And again, fatty foods might be harder to digest, so it's really better if you try to avoid those. And then some people do have a harder time absorbing certain vitamins, particularly fat-soluble vitamins. So that's going to be vitamins A, D, E, and K. So your doctor might want you to take a multivitamin afterwards just to make sure that you're getting the adequate nutrients that you need, because you might not be able to get those from your diet as easily. And then what about the absorption of drugs? So we talked about how you might not be able to digest fat as well. You might not absorb fat-soluble vitamins as well. But what about drugs? Well, some drugs are considered lipophilic, which means they're sort of fat-like in their structure. And then other drugs are hydrophilic, so they're more water-like. And so for those lipophilic drugs, the fat-like drugs, we do have some evidence that suggests that they might not be absorbed quite as well after a cholecystectomy. And that's because the bile, even though it's still there, it's still getting into the small intestine, it's not as concentrated as it is when it's being held in the gallbladder. So there's some speculation that that might cause these fat-like drugs to not be as well absorbed. But keep in mind, this is something that we are still learning about. So we don't have a lot of information or data about specific drugs and how exactly they're affected by the lack of a gallbladder. But as far as we know, it's possible that the absorption might be affected. Some of the common lipophilic or fat-like drugs are Xarelto. That's a blood thinner that a lot of people use. Also some anti-anxiety medications like Xanax or Valium. Those are very fat-like in their chemical structure. And then also antihistamines like Benadryl. These are just a few examples. There are a lot of drugs that do have the lipophilic qualities out there. So these are just a few. This is not an all-inclusive list. But for the most part, it doesn't seem like drug absorption is drastically changed by removing the gallbladder. Like I said, we do think that fat-soluble or fat-like drugs might be absorbed a little bit less, but we are still learning about this, and it doesn't appear that it will significantly impact how well the drugs work by removing the gallbladder. So overall, removal of the gallbladder is something that most people tolerate just fine. It can affect your digestive system a bit, but usually your body adjusts and you get used to it over time. And it doesn't really cause a drastic change to your body. And these are my references. And what questions do you guys have?
Let me give it a minute or two, Madeline, and see what kind of questions we may get. You might not get any. Other than your peer saying good job.
Yes, thank you.
Peers now. I see none, so I'm going to stop it.